Have you been diagnosed with non communicable diseases and feel alone in your journey?
Do you have unanswered questions and worries concerning the NCDs?
Have you ever wondered how it is to live with the NCD?
The OSIS initiative proudly presents the Non Communicable Diseases Lens, NCD Lens.
A bi monthly health podcast where we get to connect deeply with people living with NCDs, their relatives, health professionals, and NCDs advocates.
Hello everyone, this is NCDs Lens, Non Communicable Diseases Lens, a health podcast brought to you by the Horses Initiative. Today, on this episode, we have with us Dr. Yusuf Adelabu. Dr. Yusuf Adelabu is a hematologist and lecturer in the Department of Medicine, College of Medicine, University of Lagos. He's also a consultant hematologist in the Lagos University Teaching Hospital. He's a blood health advocate and the founder, executive director of the White Cell Foundation, a non-governmental organization formed to raise awareness about blood cancer in Nigeria and provide support for patients and their families. He's passionate about raising awareness on sickle cell disease, voluntary blood donation, and blood cancers. We are very happy to have Dr. Yusuf Adelabu with us.
Thank you for having me.
Thank you, sir. So today on this episode, we are going to be discussing sickle cell disease and common questions that people have about this disease, people living with the disease and people around them, their friends and their relatives. We are going to be dissecting and answering some of those confusing questions that they have in their mind. Thank you for joining us today, sir.
My pleasure.
Okay, sir. Yeah, so our first question is like a lot of people are confused. They're confused about what sickle cell trait is and what sickle cell disease is. Can you shed more light on it? Is there a difference between sickle cell traits and sickle cell disease? Is there really any difference between the two?
Yeah, thank you so much, for that question. And that's quite, fundamental to understand the difference between having a sickle cell trait and actually having the sickle cell disease. Simply put, what sickle cell traits means is that one has a copy of the sickle cell gene, and by that is able to transmit that or able to give that to one's offspring. Usually those that have sickle cell traits do not manifest the disease itself, meaning that they don't have the various features that's usually associated with sickle cell, disease, and that's what differentiates it from sickle cell disease. Many times, there may be that S gene present. So generally, those that we refer to as having sickle cell traits are those that have the hemoglobin genotype of AS, because the hemoglobin A is the normal hemoglobin, which able to function normally, but the hemoglobin S is the one that has the ability to sickle. So, but if one have portion of it to be the normal hemoglobin A and the other half to be the hemoglobin S, that is what we refer to as sickle cell traits. Whereas sickle cell disease is when one has only the hemoglobin S, because this hemoglobin usually comes in pairs. So those that have sickle cell disease would have the hemoglobin genotype hemoglobin SS. So the difference is that there's still the normal hemoglobin component present in those that have sickle cell traits, whereas in those that have sickle cell disease, they only have the S gene, in them. And they are the ones that manifest with the condition, whereas those that have the trait have the ability to pass it on to their offspring. If, say, for example, an individual that has the AS, the trait, if also has an offspring with some, it has a partner that also has the trait, there's that possibility that they could have a child that could have the sickle cell disease, because if he inherits one copy of the S gene from either from both parents, that child would have the sickle cell disease. So that's different. So we could have two parents that both have sickle cell traits, but they could have a child that has sickle cell disease.
Wow. Wow. Thank you so much for the enlightenment. So, sickle cell trait and sickle cell disease, I hope our listeners now understand, because I understand it fully now. So, I can have sickle cell traits. I can have sickle cell traits and then marry a man that has sickle cell trait and give birth to a child that has sickle cell disease.
Yes.
Thank you very much, sir. So, there are also questions on how long people living with sickle cell disease can live. Some people say 40, some say they have relatives that stay beyond 60. Can you clarify with us? Probably you've seen people, I know you must have seen people because you're passionate about sickle cell disease, and you must have also seen people in the healthcare facilities. Can you shed more light on it? Are there people, is it like 40 by 40 they will have like, did they stay beyond 50, 60, 70? And then what are the factors that influence their life expectancy? What are the factors,
Yeah,
like things
that's
that we
very,
can do?
yeah, that's very question because proud to now several years ago, part of why even in our local parlance in many of the communities and societies, sickle cell disease was previously viewed as a condition in which usually have they've not to even go past their fifth birthday. In fact, 20 to 30 years ago, most people with sickle cell disease usually have very low life expectancy. But that has changed over the years, and the main reason for this is advancement in healthcare generally, and also understanding of the disease condition of how best to actually treat the condition. And what usually happens, particularly in children with sickle cell disease, and why they don't get past a particular age several years ago, is because part of what the sickle cell disease as a condition itself predisposes one to is infection. Okay, so and many a time because then the healthcare system wasn't so well developed, so having like we do have now several type of antibiotics and all that. So many children usually die of childhood illnesses that have sickle cell disease because of even the much reduced level of immunity that sickle cell. But that has changed over the years. The life expectancy has really tremendously improved, largely because of improvement in healthcare generally, and also better understanding of the disease condition. Say for example, in the Yoruba parlance, part of what sickle cell used to be referred to is what they refer to as abiku, meaning that the
Yes.
child, the same family, they gave birth to a child, didn't get up to the fifth birthday, they dies, and that happens so many times. But and that's why even there are so many Nigerian, languages and cultures that have different names that they call sickle cell disease, just majorly based on the life expectancy, aside from maybe the other clinical features, like for example the bone pains that they usually have. But for life expectancy in this environment, we've actually even seen that have been as old as 70 years or even 80 years, with sickle
Wow.
cell disease. Over the years, and this is even globally, not just in Nigeria alone, the life expectancy for sickle cell disease have been increasing over the years because of better healthcare and also better understanding of the disease. So it's no longer a condition in which they have very limited life expectancy, even though comparatively to those that don't have sickle cell disease, the life expectancy is still a bit lower. It's still a bit reduced compared to those that do not have the condition. But like previously, whereby many of them might not even stay up to their fifth birthday. It was really that bad. 20, 30 years ago, 10, some decades ago. But now, the life expectancy is much, much improved. So we have a lot of individuals with sickle cell disease living up to their 50, 60, 70. Like I said, we even have those that have gotten up to 80. Though rare, but the life expectancy definitely has improved. And if you look at even in our country, Nigeria as a whole, the life expectancy as a country is not really, really that high. The current figures still stand between 50 and 60 years. Though we know a good number of people live above this age range. But sickle cell definitely has much better and much improved life expectancy at this time and age.
Oh, well, thank you, sir. Kudos to our healthcare professionals. And indeed, knowledge is light. Knowledge is light because knowledge about disease is helping us to create better options, management for the disease and people living with the disease, which is increasing the life expectancy of those living with sickle cell disease.
Yes.
Yes, sir. Another question I want to ask is that how can one avoid painful episodes of sickle cell? Is there something you can do to avoid, to reduce the episodes and like the frequency of this painful episode of sickle cell crisis?
Yeah, true, because that is the hallmark of this condition. Yeah, So by that I mean that is the most frequent, feature that those individuals with sickle cell, persons living with sickle cell, disease usually come up with, and this can come up, at different times. It can be episodic. and usually referred to as crisis because it's something that can keep coming, and at the time it does come, can really be quite excruciating. In fact, some individuals have it has described the pain that they do experience during these times. For even women that have even gone through childbirth, some even say that this pain is much more, even more severe than, or could be more severe than pain during childbirth. So that is one of the major things that in treating or in managing this condition is part of what. Not only do we want to treat it when it's there, as in to control the pain, but even the best thing is to even prevent the crisis, the bone pain crisis, from developing in the first instance. So with advancement in knowledge and knowing this condition better, and from research, and everything, we'll be able to identify, those things that usually bring up or precipitate the pain, meaning that this is things that lead to the development, of the pain. Of course, the number one, precipitant of it, what usually brings up this bone pain crisis or acute pain crisis that is known medically, is infection. Okay. So, and we know in our environment here, malaria infection is the commonest type of. We have mosquitoes, everywhere, and
Yes,
if one
sir.
have a mosquito bite, it's going to come down with malaria infection, and that's why part of what we do to prevent, this malaria infection, which is a known trigger of bone pain crisis, is to ensure to avoid mosquito bite as much as possible. So we advocate the use of insecticide treated nets, to wear, protective clothing, insect repellent, so making the environment clean, not to breed mosquitoes, having, nets in the windows and the doors, and all those ways to prevent the contact with the mosquito, or to prevent a mosquito bite that will lead to malaria infection. But there is also a medication preventive method to do this. So there's a medication that we also do recommend that people with sickle cell disease take regularly, so as to protect them from the parasites, even if they do have a mosquito bite. So the medication, malaria preventive medication is usually given as a daily medication. We used to do like a weekly medication, but the daily medication one is more effective and less resistant. So preventing infection is the very first, way, by which we can reduce the frequency, because more than 80% of bone pain crisis is usually triggered by an infection. There's usually an infection there. For the infection could be a parasitic infection like malaria, and that's why I talk about malaria, because it's quite common in the environment. But any other form of infection can also trigger bone pain crisis, like a bacterial infection. So maybe there's a pneumonia, there's a cough, or maybe there's even some stomach bug, or even any other type of infection generally. And part of the thing with sickle cell, like I mentioned, the immunity is a bit low, so that we also advise that they also get immunization, particularly in children, to make sure they complete their recommended, or the recommended immunization, to protect against, the common bacterial infections usually in our environment. And even for some, particularly in children, aside from giving medication, malaria preventive medication as tablet to take regularly, we'll also give some medication and antibiotic, penicillin. Penicillin will, protect against a whole number of infections that commonly cause severe infection in children. So this is more in children, maybe up to the age of 16 or 18, and that's usually recommended, because after that age, one would have been exposed to a number of bacteria, and they would have developed enough antibodies to prevent the infection. So infection is the number one trigger really for bone pain crisis. The second most important one is, dehydration. Dehydration is when one is not taking enough water, when one doesn't have, enough water in one body system. Because when there's reduced amount of water, if one is not drinking enough water, enough fluid in the body, the red cells where the hemoglobin is, whenever it's not well hydrated. By that I mean that the cells don't have enough water content. The hemoglobin, the rate of which it sickles even increases, because it changes the shape more. And that's why we do recommend to individuals, and this is even a general health recommendation, not just only for those that have sickle cell disease, to make sure that one takes adequate amount of water per day. So what's the adequate amount of water per day? For one to take between 2 to 3 liters of it. That's like 4 or 5 bottles, of water, or maybe 8 to 10 cups of water. If one is to measure it by that. But even though with sickle cell, we encourage them to even take more because they don't have the ability to concentrate urine, so they lose water easily. From urine, in urine. So you need to keep replacing it because the more they take water and stay well hydrated, it reduces the possibility of the cells, of the red cells or the hemoglobin being changing the shape to the sickle form. Because what causes the pain is that when the red cells change to that sickle form, they are not able to pass through some parts of the body, the blood vessel, they become stuck there. And by becoming stuck, they actually starve that part of the body of blood, and that triggers a painful reaction. So that's the main cause of the painful reaction. So, most of the time when there's a bone pain crisis and it comes to us, it's just by giving some drip, that's the intravenous fluid, to help rehydrate the person, and also giving some treatment for malaria or any other form of infection that have been identified. That's usually the treatment that does help the crisis to resolve. In addition to, of course, controlling the pain by giving some painkillers, that is just majorly to reduce the symptom. But we want us to have to give treatment that will ensure that the condition stop. And majorly those two things. There are others, so maybe I'll limit it to this too. Just by taking adequate amount of water and doing all that we know and help prevent infection. Those two things alone would prevent and to control more than 90% of those that have bone pain crisis, and that is why we usually emphasize these two things: to take enough water and also to be on the medication to prevent malaria and do all the other things that will prevent mosquito bites and also severe infection, but like taking some medication to prevent bacterial infection and also taking the required immunization.
Thank you, sir. Thank you. Thank you so much. So taking medications and staying hydrated. But there are still some like people always say, okay, some people even if they take, is it possible that when people even take these drugs and go for their immunization, stay hydrated, is there like a is it like there's some people that are more predisposed to having episodes? Is it like probably the sickle cell disease is greater in some people, even if they do all of these things, they still come to the hospital with sickle cell crisis. Is there any genetic predisposition to people that even though they do all of these things, is there anything like that they still come to the hospital with crisis? While some people that don't even really do many of these things, they don't start showing signs till they are 15 or 16.
Yeah, so that's excellent question, because really that's what in real life do happen really. In fact, what we usually say is that no two individual with sickle cell disease are exactly the same, even if they are actually twins. And the reason being, we found out that there are a number of things that do modulate. I mean, I think that create some differences really in terms of how some people fare better than the others, even keeping a lot of things constant. And so part of what research has been able to show, in science, to see that okay, so what actually makes or what differentiate the manifestation of sickle cell disease from one individual with sickle cell to another person with sickle cell disease. So one of the things that we've actually identified is that even though those with sickle cell disease do have the hemoglobin SS, meaning that they have two copies of the hemoglobin gene, that is that can produce the hemoglobin that can sickle, but there are other types of hemoglobin within the body, within the red cells, that are produced in the minute amount of quantity that do interact with the hemoglobin S and changes the way it manifests. And that's what we have seen as a major difference, and this is also genetically built up. So there is a type of hemoglobin which we do have while we are growing in our mother's womb, as a fetus, as a baby, we call it the fetal hemoglobin. So it means shown that those with sickle cell disease that have a higher level of this hemoglobin F, or this fetal hemoglobin, after they've even gone past the age of 6 months, because usually there is a switch from the production of this fetal hemoglobin, where after birth, it's up till about 6 months. By 6 months, the adult type of hemoglobin, which is whether AA, if the person is A, or AS or SS, will be what is produced. So that is A hemoglobin or S hemoglobin, as the case may be. But those with sickle cell that can only generally produce only S, they still produce a small amount of the fetal hemoglobin, that hemoglobin F. So the higher the level of that hemoglobin F, the lesser the effects of the sickle cell. So that is what research has shown us. And that is why when we see two individuals with sickle cell disease, they don't manifest the same way because those that have higher hemoglobin F tend to have lesser crisis. In fact, some don't even have crisis in 5 years, in 6 years. Some have not even had crisis in a long time. While some, almost every week or every month, despite doing all that mentioned, they aren't doing everything, with it. And it's because they have a lower amount of hemoglobin F. But we know that even if other things are done, like having to prevent malaria infection, staying hydrated, that can still reduce it some more. But despite that, that is also a component. The other things in the blood that interacts with the red cells, that do sickle, like the white cells and the platelets, because all of these are interacting with the blood vessels where the blood flows through. Like I explained before, when the red cell changes shape to become sickle and become rigid, they're not able to pass through tiny blood vessels, so they get stuck there. And that stops that part of the body blood supply and triggers a painful reaction, a painful response. It can even cause organ damage, and those are some of the other manifestations of sickle cell disease. So this, understanding this, that level of that beta hemoglobin and other components in the blood, like the white cell, the platelet, have an effect on how sickle cell manifests. That has now even led to the development of a medication that can help increase the level of that hemoglobin F. That's the medication we call hydroxyurea, which has been shown to really, really be, effective in this light. So the main thing, so that hemoglobin F, the one that is produced in the body genetically, is what makes that difference between one individual. That's why some people have it so good, relatively, while others, might not be so lucky. What we found genetically that can explain that is the difference in the level of the hemoglobin F. And so that is the only main feature that have been seen for sure, that one can say this is responsible for the difference, as opposed to but other things are not really, there's no really strong evidence for that. The only thing that I have strong evidence for is what I've just explained about the hemoglobin F being a dilution factor for the hemoglobin S in sickle cell disease. And so with this, we're able to take advantage of this medically by giving a treatment that can help improve this. So but that's the genetic, undertone too. While different people with sickle cell disease manifest the disease differently.
Wow, that was insightful. So hemoglobin F, and then using hydroxyurea can help increase hemoglobin F in the body. So hydroxyurea is important.
Yeah,
Very
we
important.
strongly advocate the use of it.
Yeah. Thank you, sir. So I also want to ask if I'm a family member or a friend, yes, or people or someone living with sickle cell disease, is there any way I can help as a friend or as a family member? Is there any way I can help someone living with sickle cell disease around me? What can I do? I know a lot of people will be listening to this episode of the podcast and be wondering, how can I step in? What can I do to help my friend living with sickle cell disease, or my family, or my sister, my brother, or my cousin? What can I do? How can they help?
Yeah, great. So this is something that so everyone should know. In fact, what I would say is that because in Nigeria here, we started the discussion by talking about those with sickle cell traits. 25% of Nigerians actually carry the sickle cell traits. For it, because it's really, really that's rampant. So there's almost no family in Nigeria that don't have at least one person with sickle cell related to them, either directly or indirectly, or even if perchance you do not have any close, family member that do have this condition that you can directly relate to, in your school, in your place of work, you would either have a colleague or in a classmate that do have this condition. So that's why it's very important for you to understand this condition, because Nigeria has the highest number of people with sickle cell disease globally. Of course, we are the most populous black nation in the world. The gene is most prevalent in our environment. In fact, more than 50,000 babies are born annually in Nigeria with sickle cell disease. So this is something, a condition everybody should know about, because it does affect everybody directly or indirectly. And so the first thing I would say, for individuals that don't have this condition but know or have someone in the family that have this is that you have to be very supportive because those with sickle cell disease require a lot of support from us to be able to even cope with the condition itself. Because this is a condition in which is genetic, it's part of them. It can be genetic. Perhaps we may talk about some treatment options that are there. But this is something that they've had right from birth and would be with them all through. But we can make it better for them. We could make them to have a stress-free, life and to ensure that they get to the fullest potential of their ability. So the first thing is to not to stigmatize because part of what usually affect those with sickle disease even more, particularly those that are because yes, it does take a toll not just only on the individual but also on the family because having to go frequent the hospital so many times, seeing your loved one, breathing in pain, and having to maybe take medication every day, it can emotionally, psychologically, it can really have a lot of effects, on one. And that's why all the support that, can be given. So if you have a colleague or a classmate that has this, so don't stigmatize them. And by stigmatization, I mean that, the fact that, oh, they are all, they usually, experience some bone pain crisis, or maybe they're even maybe are absent from school. Maybe at times they might not just feel so well to be able to do something that we expect them to do, maybe some physical activity, and all that, or maybe at times they may call in sick and all that. But let's show them that there's support, and also the encouragement that they need to be able to go through this because if they have this and even at times they also need that support to be able to do the things that would also help them to be healthy like I mentioned, having to take adequate amount of fluid, so reminding them or encouraging them or supporting them in every way possible. So showing a lot of support and encouragement and avoiding stigmatization. That is like the minimum that we all are expected to do. If we could even take it a step further, to also even help them, particularly when they are manifesting some of these, but particularly the painful condition, really. First, the first thing is to ensure that, we usually advise that they do have some pain medication to take, as soon as the episode starts, not to wait to when it's really, really quite severe. Of course, if that doesn't help, because they would need, they may not be able to take themselves to the hospital, for example. So we should be there for them, to whenever they need that help and support to be able to, assess the care that they need. And also, particularly for parents, we usually mention this so that in fact, they should ensure that, they give them very good food because if they actually eat a healthy and balanced diet, it improves their immunity. So taking fruits, vegetables, all the good food that we could lay our hands on to ensure that they get the best. So making sure the environment is clean, they're not exposed to germs or infection or things that would harm their health. So there are a whole lot that we could do, and many of these largely is to be able to help them to live a healthier and better and stress-free life. So basically they need our support, they need us not to stigmatize, and they need encouragement, and to ensure that they live a good life.
Okay. I hope our listeners are hearing. So they need our support, they need our encouragement, they need our help, and we should avoid stigmatization. So, sir, even as we'll be rounding up this episode, we're rounding up this episode now. So, is there any word you would like to share with us? Is there anything you just want to tell people that will be listening to this podcast? Is there anything you want to tell us? Probably we've not touched, but it's very important. Maybe something about sickle cell disease and genotype. Is there anything you want to tell us? I know there are a lot of things you want to tell us, obviously, because sometimes
Yeah.
dermatologist and you will have seen a lot of these things and you will want to relay message to people, like people generally in the world. So is there anything, are there things, very important things? Just help us.
Yeah, well, one major thing which, like I said, in this part of the world, particularly in Nigeria, this condition is very, very rampant. And in a number of things that can be done in public health wise, as in advocacy wise, to help to reduce this over time. Of course, aside from treating those that already have the condition, the aim is to see how we can reduce the burden of this condition in our environment. And so The very key message I would want to pass across is that every one of us should know their genotype. So know your genotype status. So you know whether you're AA, whether you're AS, or whether you even have this condition itself. So that's the very first thing. The second thing is also for people, particularly intending couples, to go for what is referred to as genetic counseling. Now, what genetic counseling means is not that, oh, because you are AS, you'll be told not to marry one another. No, that is not what genetic counseling, means that aside from you getting to know your genotype, you are going to be counseled or educated or enlightened or more informed about number one, what sickle cell disease is, the possibility of you having a husband with sickle cell disease, what are the options or what are the ways by which that can be prevented, so that whichever couple, intending couple, when they are equipped with that information, they can make an informed decision of what they want to do or what step the decision usually left for them to take, but you know empowering them with the information that they require in terms of how this could actually affect them, and the things that they can do, otherwise to be able to prevent this, because there are so many things, ranging from testing to see if the fetus, if the baby they're about to have it or not, other options of building a family aside from having to have their own kid themselves, maybe surrogacy or maybe even adoption. There are so many things, but the reason why this is the best strategy to go with as genetic counseling is that if you put a legislation down for people with sickle cell traits not to marry one another, this has been tried in some other countries, and many a time it does backfire. It doesn't really work. But what has been shown to effectively to work is to erase or increase the level of screening that a lot of people to know their genotype status, because many a time, in fact, for many people that are now adults, many of their parents never knew their genotype. They didn't even know what sickle cell is. They didn't know whether they are AS or SS or what to even, Yes, we know that some people do know and still, go ahead with this. But the very first step is that enlightenment, that empowerment. Because if you are equipped with the right information, then you can take an informed decision, or how you, and then you know what, to do and what to expect. Because even for those parents that have children with sickle cell, because they were not even aware of, they don't even know how best to treat, or not even to treat, how best to actually cope with the condition with their children. So they don't know where to get the right help. They don't know what and what to do, the do's and the don'ts. They don't know how to encourage their children and all that. And that's why many families really have issues with it. And sadly, we've lost some people with sickle cell disease just because people are not well enlightened. And that's why having discussions like this is very important to raise that level of awareness. So when people are aware and they write the right information, it does help in improving their health. So the two key messages are that for everyone, even those that are adults that don't know, even if you are done it before, you're unsure of it, because that's also a challenge that has happened, or that we always, but it's less rampant now, because a few years back, a number of people thought their genotype was a particular thing. Maybe they think that they are actually AA, but whereas they actually had a wrong result or a not well done test. So it's always good to have it done in a reputable hospital or laboratory where it's certified to have the correct test being done, so you have the right result. Because we've actually had cases like that in which people had the wrong result. They thought they've always known themselves to be AA while they were, in childhood, only to get to know later they're actually AS because of a wrongly done test. So knowing one's genotype is very key. That's one key message. If I have to say anything, that's the first thing to do. And for those that are not yet married, intending couples, always should always go for genetic counseling. Prior to that, particularly because genetic counseling is not just only limited to sickle cell disease. There are other conditions that are genetically inherited or that are inheritable, in which the same things could apply. But for sickle cell is the main focus because it's really, really quite prevalent in our environment. Said Nigeria has the highest population of those with sickle cell disease worldwide. Not just because of our general population, because the gene is also very, very prevalent here. So know your genotype and go for genetic counseling. Those would be my two key messages to everyone listening.
Thank you. So I know a lot of us have heard about knowing your genotype, go and know your genotype, know if you're AS, SS. but I don't think many of us have heard about genetic counseling. And our wonderful consultant hematologist, Dr. Yusuf Adelabu, has advised us, especially intending couples, to go for genetic counseling when they're about to get married. Now, a lot of us, I know you've listened to this episode and you're here now and you're like, wow, this is packed, which is why you should share this podcast with your friends, with your colleagues, share it on your social media, and